You may be wondering what a brow lift is and why you might have one. I typically like to do a minimally invasive brow lift in the tail of the brow to help patients that have the early symptoms of loose upper eyelid skin, which is from deflation of the eyebrow, as well as the shape of the brow, which as we're aging typically starts to drop at the tail. A female brow usually looks beautiful when it's a little bit higher laterally and also a bit more awake. So the brow lift is a procedure that allows us to change the shape by lifting the tail of the brow a bit, as well as the position of the brow vertically. When I'm looking at a patient to see if they're a candidate for a brow lift, mainly in a female, I make sure that the tail of the brow could use a little bit of lifting. So if patients have already kind of a high brow or a tattoo that's very high, then I might not do my minimally invasive temporal brow lift technique because it might make them look a bit angry. And I've never had that happen, and we don't want you to be the first. There are a few reasons why I love my minimally invasive temporal brow lift. Most brow lifts, the ones that people are familiar with, are ones where incisions are made behind the hairline and the whole forehead is lifted. Now I do those on occasion, but I much more prefer this minimally invasive temporal lift because the ones that are behind the hairline typically elongate the forehead because they pull the hairline back, and they typically, in my hands, don't necessarily give the brow as youthful of an appearance because they lift the medial brow and the tail. And so the shape is kind of, the whole thing comes up, as well as, in my hands, not being as long lasting because there's no tissue removed. Now let's talk about the surgical process and how I do my minimally invasive temporal lift, and so you can see why I love it so much. First of all, the lift is only done where a brow really needs to be lifted, which is only at the tail. And so I hide an incision right at the hairline. That way, if there's any faint line, which is very rare, it's already located in a place where the brain or the viewer kind of is going to see a faint line, the junction between the hair and the forehead. And so by putting that incision there, it accomplishes a few things. One, it's an effective lift because it's closer to where the brow has to be. Two, I actually remove a little ellipse of tissue there. And so by removing that ellipse of tissue, the brow kind of heals in a bit of a higher place and so stays that way a very long time. The other thing that's nice is that you don't elongate the forehead. If anything, the forehead is a little bit shorter, and so it doesn't make it look like you have a receding hairline. One of the most common questions patients have are, what does the scar look like on this minimally invasive temporal brow lift? This is actually something that I'm very proud of because I've evolved this technique to really have this heal most commonly without any visible scar. Usually at about 2 to 3 months, patients are able to wear their hair back and not have it be seen by the general public. Of course, if you look very closely under the microscope or in a mirror, oftentimes you might be able to see a faint line, but usually the way that it's designed, by putting it right at the hairline, having it heal with no tension, makes it occur in such a way that it's usually scarless. Pictures speak 1,000 words, and fortunately I had a patient that recorded her recovery process on a daily basis after her upper eyelid blepharoplasty and temporal brow lift. You can see in these pictures the patient has mild bruising around the eyes and very minimal bruising around the forehead, and you can see that there's some staples in the corner, and those are removed at around day 5 to 6. But pretty quickly after removal of the staples, given the fact that the hair can be worn down, you can see that the scarring heals quite well and it's pretty invisible, and there's a very nice natural looking lift to the eyelids when the brow comes up. Being that one of the most common questions I get is, where is the scar and what will it look like? I thought I'd also share a lot of after pictures close up with the patients holding their hair back so you can see where the incision is. But fortunately, you oftentimes can't even see it, but these are all patients here that have healed and recovered usually about 2 to 3 months after the procedure. The incision is kind of hidden in the hairline towards the corner, and usually the scars are pretty invisible. If you look closely, however, you can oftentimes see something there, but the human eye just doesn't really see it. It's natural to kind of have a wrinkle or a faint line in that area. Complications associated with my minimally invasive temporal brow lift are pretty rare. That's one of the reasons why I love the procedure so much, and are usually just related to, number one, sometimes the scar can take a bit longer to heal. There might be little lumps or bumps on it, and very rarely, maybe once a year, I do have it that some of the skin around the scar doesn't have a good blood supply, and so it kind of has a scab for a bit longer. But the patients have always healed well. It just potentially takes a little bit longer. If I had to think about what's the most common complaint I've gotten, I've had a couple patients in my career that have just said, I wish you could have lifted it higher. But that's what comes down to one of the reasons why I love this technique so much, is that I've never had a patient look unnatural, look too pulled, or look surprised, which is something you do sometimes see in more traditional kind of behind the hair brow lifting techniques. In summary, there's a few reasons why I love my minimally invasive temporal eyebrow lift procedure. Mainly it's because it's a relatively quick, low invasive procedure that gives us long-lasting and effective results, which is by improving the shape of the brow, as well as doing it in a fashion that it's pretty easy for patients to cover up. In the short term, they can use the long hair to kind of cover it, and in the long term, it heals so well that patients are very happy. I hope I have the opportunity to discuss it more with you in person and help you reach your aesthetic goals.